The word care is everything in this world. एक बहुत पुराना शेर है, वो पूछ लेते हमसे कि तुम्हारी मुसीबत क्या है, सो हमारी मुसीबत ही क्या थी अगर वो पूछ लेते हमसे. Entrance is also the similar thing, you know. A lot of time people are not cared for, and there they lose this battle. And you know what is care in this word? The care is the best utility of your time, and for that you need protectors. And one of the most important protector, you know who's the most important protector for your own entrance exam preparation? You yourself. How? My grandmother used to tell me one thing. अगर आपने दिन में सूर्य उदय नहीं देखा तो आपके करियर का सूर्यास्त हो जाएगा. Means rise early and see the sunrise. That's the way your careers are built up. This is called as care. Care for your time. Leave the bed. बिस्तर तो छोड़ना ही पड़ेगा. If you keep on lying down, it is only going to increase your malaise and decrease your productivity. So the best thing to do is start studying early. But somebody said, sir, is it necessary that anybody who ever qualifies is the person who rises up before the sunrise? No. But then, you know, it cannot be both the ways. You're getting up late and sleeping early, you know. Then if you're getting up late, then sleep late. I know one of the very brilliant examples, right? One of my dear friends, Dr. Praveen Tripathi, he has a habit of getting up a little late, but then he stays up late till night. So his productivity is the number of hours, and he takes rest and he takes things very easy. Being a psychiatrist, he understands the principle that sleep should never be compromised for your good mental health and your physical health. And you also need to understand the same. जो व्यक्ति समय की कीमत नहीं करेगा, समय उसकी कीमत नहीं करेगा. We all have 24 hours in a day. And we can at the best study for 10 hours. If you're really good, 12 hours, and very rare students can study for 13 to 14 hours. So let's assume you are a good student and you're doing it for 10 hours. Out of those 10 hours, you have to increase your productivity for 22 hours. How to do that is the trick. You need to have a plan. The moment you don't have a plan, you will think about studying for 10 hours and you end up just doing 4 to 5 hours, and there you lose it. So what I want to tell you here is your principle should be very simple. That I get up early, I start revising, I do MCQs, I do listen to some important topics, and if I feel that there are questions which I am not able to solve, I'll go to my notes, improve my notes and read the topics, and if required, watch that video. So I should have a very clear plan what I want to do during a day. Second thing which I feel is people get stuck up. You know, it's about movement in entrance exams, and if you do not move to the next topics, you're gone. So I'll give you an example. If I have kept 2 days for ortho, 2 days for anesthesia, at the end of day 2, I have to complete ortho, and on day 3, I have to start with anesthesia. If I don't do that and I encroach upon the time of anesthesia by trying to put in and squeeze some ortho there, I will have 2 losses. Ortho, the topics which I will squeeze on the day of anesthesia, I will be doing it in hurry to harm it. Number 2, I will decrease the time allotted for another subject. So I am harming 2 subjects. What is the way out? The way out is make sure you read significance wise. When you read significance wise, it automatically delivers into productivity, and that's what is important. You don't prepare for entrance chapter wise, you prepare significance wise, and that is why many a time you see that a teacher is teaching certain subject and topics into the order of significance. That's the way to do it. The textbooks index is not the same as the MCQ books index. For example, if I'm reading textbooks, I'm going to tell you that read basics of trauma principles is the first chapter, but when I want to talk about entrance exam, I will tell you go for arthritis, go for nerve injuries. These are the areas where the topic will come. In textbooks, lower limb trauma is elaborate, but in upper limb trauma is predominantly in the MCQs, and that's where you need to understand that MCQ exam will still have the same topic, but the orders will be different, and there where the order of significance is the key thing here. So to increase your productivity to going up to 10 hours, you need to be very clear what you want to do on this day. You need to play on your strength. You need to let go of your weaknesses. Get up early if you can be an early riser. If you get late, stay up late. Don't compromise on your sleep and food. Have a good care. And at the end of the day, ask yourself this question. वो पूछ लेते हमसे कि मुश्किल क्या है, तो फिर मुश्किल ही क्या है जो वो पूछ लेते हमसे. To summarize, what areas are your lacunae? And then come back tomorrow stronger. The Japanese saying is, I fall 8 times, I rise the 9th. That's what you should do. If you have lost a day, don't carry it forward in your mind. Next day, come sharper, come brighter, kill it. Thank you.